Chronic fatigue or chronic fatigue syndrome is probably the most broad-based diagnosis that I've ever seen in my life. Well, right here, a chronic fatigue survivor. I was diagnosed with chronic fatigue. What does it really mean? It means you have fatigue that lasts more than 6 months. But it's just a name given to a set of symptoms, and usually it goes beyond just fatigue. It usually goes into anxiety, the inability to sleep correct, headaches, even into fibromyalgia, which can occur with or without it, chemical sensitivities. All of these types of conditions really have the same origin. A brilliant biochemist named Martin Pall has really redefined what is the 10th paradigm of medicine. Right now, there is 9 accepted paradigms in medicine. However, when you go to your doctor and you do not fit into any of those 9, guess what? Usually you get a diagnosis of it that it's all in your head. And usually the treatment is a psychotropic drug. That was my diagnosis. That was my treatment. However, I didn't go for it. I realized that there was a cause of why I lost my life, debilitating for 4 years. Now, when we treat chronic fatigue, I always talk about getting to the cause. These conditions are neurotoxic disorders. However, the tricky part is not every toxin, or I should say not every person with chronic fatigue is affected by the same toxin. In my case, it was definitely led by mercury poisoning. However, Martin Pall has defined the 10th paradigm of medicine is really an inflammation oxidative stress cycle that really doesn't get down-regulated by the body. He talks about 7 categories of toxins, some of which are pesticides, mercury, even mold. These are the things that can trigger this cycle and break the cycle. What I do, and really what I've really figured out in getting myself well and treating thousands of patients with these illnesses across the country, is not only do you have to down-regulate this vicious cycle of inflammation, but you also have to empty the patient's bucket, meaning that you have to remove the toxins that have embedded or bioaccumulated in the patient's flesh, even in their brain and nerve tissue. So if you don't empty the bucket, remove the toxins, you'll never be able to down-regulate the cycle. However, if you remove the toxins and you don't fix this broken inflammatory cycle, then you're never going to get the patient well. This is really the things that I teach even my doctors, but I also teach it to my patients. Because if we are going to really make an impact on these conditions that are now an epidemic in this country, you have to get to the cause, and really it is toxins. But you have to understand the biochemistry and the etiology of what these toxins are doing to the system. I hope that helps.